All right, I wanted to start this one off by sharing a little bit about my first diagnosis. Um, it's the first time that I ever experienced something super medical, and I guess it's really what shaped my history as far as, what I've went through and what I continue to go through. It's where it all started. The first thing that I started feeling is I just felt sick. I struggled a lot, or I was struggling a lot with diarrhea. I was struggling a lot with nausea and pain in my abdomen on the upper right side. I kept going to doctors, primary appointments, ended up going to some different ERs, trying to get somebody to pay attention and tell me how to fix whatever was going on. The next symptom that I noticed was I started losing a lot of weight. I wasn't eating, couldn't drink anything, couldn't keep water down. I would eat it or drink it and end up in the bathroom. Not throwing up, but with diarrhea. I noticed during that time I had ended up dropping around 100 pounds in less than a month. So that was very, very extreme. I had just started a new job, couldn't go to that job, couldn't walk, could barely hold conversation, didn't feel like a lot of fun. It was just awful. I got so bad. One night, I ended up throwing up and having diarrhea. And the whole time prior to that, I had never thrown up. So I knew something was going on. I, at the time, was with my ex. She had to work in the morning. She was exhausted, was in bed. So I ended up getting a hold of my mom. My mom came and got me, took me to the ER, and instantly at the ER, they gave me a GI tube, which is this awful thing that they put down your nose and into your throat, and it sucks out all the crummy stuff that's down there. Every time that I've gotten it, it's been awful. So if you have to get it, just know it's awful, but you can make it through because I have every time. I got that and then was immediately rushed into emergency surgery. They ended up doing a bowel resection. Reason being is there was an abscess that had formed and ruptured on my small intestine, which is where my Crohn's is active. The abscess that had ruptured was making me septic. So it was definitely not a fun situation. I woke up and they ended up stapling me closed. About a week and a half, maybe 2 weeks after my surgery. I went for a follow-up appointment. The doctor touched my belly, and in the process of that, my belly was really sensitive and it hurt more so than the normal person hurts while in recovery. They're like, yep, we're going to have to open you back up, take the staples out, you're collecting fluid. So they opened my belly up right there on the table in the office. It was awful and scary and probably should not have happened that way, but it did. So they did that, got all the fluid out. So got sent home. It was fine. Then all of a sudden, maybe 2 weeks after that, I was at my grandma's and it felt like I had run a marathon and I wasn't running anywhere. I was in recovery, just had surgery. It was super traumatic. It was awful. But it felt like it. My legs hurt real bad. I was like massaging my legs. Then all of a sudden I just couldn't catch my breath. It was awful. That passed, ended up going into the bathroom, and I instantly remember getting really warm. Like warm. Before you vomit, kind of, but a lot worse. Then I remember coming to and was on the bathroom floor. Come to find out, I had passed out. So I woke up and I felt fine, other than being on the bathroom floor. So called my mom, told my mom. She's like, go to the ER. So we went to the ER. Needless to say, I ended up with a PE/DVT that had started in my right leg. It started in my right leg, gotten loose, and made me pass out. If you know me, you know that my family has history with blood clots. I have never had anything like that until this. This was the first time it presented for me, and it was super scary. So there's that. After that, I was on blood thinners for a very long time. I ended up being open with my incision for a year and a half, having to change it and deal with the pain and all of that for that long was awful. After that, I ended up actually being semi okay. I mean, dealing with my illness the best way I could. I still had diarrhea, still had nausea, still had pain, but it was nothing like what I experienced with the abscess and the rupturing. So I was okay. I ended up not taking Crohn's medication, and it lasted for about 10 years about. And then that brings me up to 2016. 2016 is where all of the new things that have happened in my life with my medical issues has happened. That's going to be another video where I'll go into what this looks like and how it all started and all of that. But I just wanted to give you a good overview of my life with my Crohn's disease in the beginning. The first episode that I had, just so you had an understanding of where I was then and where I am now and where I have started this time around at.